Explain the structure and function of the respiratory system in mammals. How does this system differ between species, and how does it contribute to maintaining animal health? Answer: the respiratory system in mammals is responsible for the exchange of gases, oxygen and carbon dioxide, between the animal's blood and the external environment. It includes structures like the nasal passages, pharynx, larynx, trachea, bronchi, and lungs. The primary function of the system is to provide oxygen to the bloodstream for cellular respiration and to remove carbon dioxide as a waste product. In terms of species differences, mammals show variance in respiratory structures. For example, in humans, the diaphragm is the primary muscle for respiration, while in many quadrupeds like dogs, the ribcage and intercostal muscles play a more dominant role. The anatomy of the lungs can also vary significantly, with some animals like horses having a more extensive lung capacity suited for endurance. Maintaining proper respiratory function is crucial for animal health. Respiratory diseases like pneumonia, asthma, or bronchitis can impair gas exchange, leading to hypoxia, lack of oxygen, or hypercapnia, excessive carbon dioxide. Preventative care includes ensuring proper ventilation, vaccination against respiratory infections, and avoiding environments with excessive pollutants or allergens. Discuss the role of nutrition in preventing common diseases in pets, focusing on how deficiencies or excesses can lead to health issues. Answer: nutrition plays a key role in preventing numerous diseases in pets. A balanced diet ensures that an animal receives adequate nutrients for growth, maintenance, and overall well-being. Common deficiencies and excesses can lead to various health conditions. Deficiencies: a lack of essential nutrients like vitamins e.g., vitamin D, minerals e.g., calcium or proteins can lead to conditions such as vitamin D deficiency can cause rickets in young animals or osteomalacia in adults, leading to weakened bones. Calcium deficiency leads to bone disorders like osteoporosis or osteodystrophy. Excesses: too much of certain nutrients, such as excessive fats, can result in obesity, a condition that predisposes animals to diabetes, arthritis, and cardiovascular diseases. Oversupplementation of vitamins. Excessive vitamin A or D can be toxic, leading to hypocalcemia and liver damage. Preventative measures include providing species-appropriate diets, regular monitoring of weight, and adjusting feeding quantities based on age, activity level, and health status. Regular vet checkups should include nutritional assessments and dietary adjustments. Mrs. Green is noticing that her pet rabbit, Thumper, is becoming increasingly lethargic and is eating less than usual. After a few days, she notices Thumper has stopped eating altogether. She is concerned and unsure what steps to take. What should Mrs. Green do in this situation? Answer: in this scenario, Mrs. Green should take immediate action to address Thumper's health concerns. The symptoms of lethargy and loss of appetite in rabbits can indicate several potential health issues, such as gastrointestinal stasis, a common condition where the digestive system slows or stops, dental problems, or an infection. Step 1. Mrs. Green should carefully examine Thumper for other signs of illness, such as dehydration, skin tensing, or sunken eyes, diarrhea, or bloated abdomen, which are all potential indicators of gastrointestinal issues. Step 2. Mrs. Green should seek veterinary advice promptly. Rabbits have a very sensitive digestive system, and delaying treatment for conditions like GI stasis can be fatal. The vet will likely perform a physical examination and may recommend diagnostic tests including blood work, radiographs, X-rays, and fecal analysis. Step 3. In the meantime, Mrs. Green should try to encourage hydration by offering water in a syringe or soaking fresh vegetables in water to promote fluid intake. The underlying cause needs to be determined by a veterinarian, who may treat Thumper with medications to stimulate digestion, manage pain, or address any infections. Describe the basic principles of animal anatomy and how understanding these principles can aid in preventing injury and improving overall animal welfare. Answer: animal anatomy refers to the study of the internal and external structures of animals. A sound understanding of anatomy enables animal care professionals to identify potential areas of injury, stress, or disease and take proactive measures to prevent harm. Musculoskeletal system. Knowledge of bones, joints, and muscles allows for the prevention of musculoskeletal injuries in animals, especially in working animals or those involved in sports. Proper handling, adequate exercise, and avoiding physical strain are crucial to preventing joint problems, muscle strains, and fractures. Nervous system. Understanding the nervous system helps in identifying signs of neurological distress, such as abnormal gait or posture, which can indicate conditions like spinal injury or encephalitis. Timely intervention can prevent long-term damage. Cardiovascular system. By understanding the circulatory system, caretakers can recognize symptoms of poor circulation, dehydration, or shock, leading to prompt action in rehydration and improving blood flow. Comprehending anatomy also aids in performing routine health checks, recognizing early signs of illness, and adjusting care strategies accordingly. Discuss the differences in the digestive systems of herbivores, carnivores, and omnivores, and how these differences affect their nutritional needs and health management. Answer: herbivores, carnivores, and omnivores have different digestive systems that are adapted to their dietary requirements. Herbivores, e.g., cows, horses, have a longer digestive tract with specialized stomachs or intestines to process plant material, which is high in fiber and low in digestible nutrients. Their digestive systems often include complex systems such as a rumen in ruminants, where fermentation occurs to break down cellulose. Nutritional needs: herbivores require a diet high in fiber to stimulate proper digestion and support gut health. Excessive protein or fat can lead to metabolic issues like obesity or kidney disease. Carnivores, e.g., cats, dogs, have shorter, more acidic digestive tracts optimized for digesting animal protein. They produce large amounts of stomach acid to break down meat and fat. Nutritional needs: carnivores require a diet rich in proteins and fats. Excessive carbohydrates can cause digestive upset and obesity. Omnivores, e.g., pigs, chickens, have a digestive system adapted to process both plant and animal matter. Their digestive tracts are more versatile and can handle a balanced diet that includes proteins, fats, and carbohydrates. Each species' dietary requirements must be met to maintain optimal health and prevent diseases related to poor nutrition, such as gastrointestinal disorders, obesity, and deficiencies. Relevant guidelines, regulations, animal welfare regulations, such as the Australian Animal Welfare Standards, stress the importance of providing species-appropriate diets based on their natural feeding habits to ensure their health and well-being. How does understanding in animals' physiological processes help in recognizing early signs of illness? Provide examples of physiological changes that indicate health concerns. Answer: understanding the physiological processes of animals, such as body temperature, heart rate, respiration rate, and digestion, is essential for recognizing early signs of illness. Temperature: a fever, high body temperature, often indicates an infection or inflammation. Conversely, a low temperature may suggest hypothermia or shock. Heart rate: an increased heart rate, tachycardia, may indicate pain, anxiety, or cardiovascular issues, while a very low heart rate, bradycardia, can point to respiratory failure or hypothermia. Respiratory rate: changes in respiratory rate or effort, e.g., rapid breathing, wheezing, or labored breathing, often signal respiratory conditions such as asthma or pneumonia. Digestive changes: diarrhea or vomiting may point to gastrointestinal distress or infections, while constipation or bloating might suggest obstructions or other severe conditions. Early detection through physiological monitoring allows for timely intervention, preventing conditions from worsening. Mr. Parker is concerned about his dog Max, who has been scratching excessively. After a few days, Max develops red, inflamed patches on his skin, and the scratching worsens. What are the possible causes, and what should Mr. Parker do to address the situation? Answer: Max's excessive scratching and skin inflammation could be caused by several issues, including allergies. Environmental allergens like pollen or dust mites or food allergies could cause itching and inflammation. Parasites: fleas, mites, or ticks are common culprits for itching and skin irritation in pets. Skin infections: bacterial or fungal infections can lead to skin redness and itching. Step 1. Mr. Parker should check for visible signs of parasites, such as fleas, ticks, or mites. If found, a topical or oral antiparasitic treatment should be used. Step 2. If no parasites are found or if the condition persists, a veterinary consultation is essential. The vet may perform skin scrapings or blood tests to diagnose allergies or infections and recommend appropriate treatments. Relevant guidelines, regulations. Under the animal welfare standards, it is required to promptly address health concerns, including parasitic infestations or allergic reactions, to prevent further discomfort and potential harm to the animal. How does a balanced diet influence the immune system in animals, and how can nutrition help prevent common diseases? Answer: a balanced diet is essential for the proper functioning of the immune system in animals. Key nutrients like proteins, vitamins, minerals, and fats play a crucial role in immune function. Proteins, amino acids, the building blocks of proteins, are vital for producing antibodies and immune cells. Vitamins and minerals, vitamins A, C, and E, along with minerals like zinc and selenium, are essential for maintaining immune health. Fats, omega-3 and omega-6 fatty acids, help modulate the immune response and reduce inflammation. proper nutrition helps prevent diseases by ensuring the immune system can effectively fight off infections, reduce inflammation, and promote tissue repair. A deficiency in any of these nutrients can lead to weakened immunity, making animals more susceptible to diseases like respiratory infections, skin conditions, and gastrointestinal issues. What is the relationship between animal behavior and health, and how can understanding behavior help in diagnosing and preventing illnesses? Answer: animal behavior is often an indicator of health. Changes in behavior, such as decreased activity, aggression, or hiding, can signal discomfort or illness. For example, decreased activity could indicate pain, illness, or discomfort. A sudden decrease in movement could point to musculoskeletal pain or internal issues like gastrointestinal distress. Aggression can be a sign of pain or discomfort, particularly in animals with undiagnosed conditions. Changes in eating habits. Refusal to eat or overconsumption of food can indicate health issues like dental problems, gastrointestinal diseases, or metabolic disorders. Understanding typical behavioral patterns helps in early diagnosis and provides insights into the specific areas of health that may need attention. Relevant guidelines, regulations. The Animal Welfare Act requires that changes in behavior due to health issues be promptly addressed to ensure the animal's well-being. Explain the role of vaccinations in maintaining animal health and how vaccination schedules can vary across species. Answer: vaccinations are critical in preventing a wide range of infectious diseases in animals. They stimulate the immune system to recognize and fight off pathogens without causing the disease itself. Core vaccines. These are vaccines recommended for all animals, such as rabies, parvovirus, and distemper in dogs. Core vaccines are vital for preventing life-threatening diseases. Non-core vaccines. These are species-specific vaccines that are recommended based on risk factors such as leptospirosis in dogs or feline leukemia in cats. Vaccination schedules vary by species, age, and lifestyle. For example, puppies and kittens typically start their vaccination series at around 6-8 weeks of age, followed by booster shots. Adult animals require boosters every 1-3 years, depending on the vaccine and regulations. Relevant guidelines, regulations. The Australian Veterinary Association (AVA) outlines vaccination protocols for companion animals, ensuring optimal protection against preventable diseases. Why is it crucial to implement biosecurity measures in animal care facilities, and how do these measures help in disease control? Answer: biosecurity measures are essential to prevent the introduction and spread of infectious diseases in animal care facilities. These measures typically involve controlling access to the facility, monitoring animals for signs of disease, and implementing quarantine protocols for new or sick animals. The purpose is to minimize the risk of zoonotic diseases, those that can be transmitted from animals to humans, such as rabies or tuberculosis, which pose significant health risks. Key biosecurity practices include controlled access, limiting access to authorized personnel only, quarantine and isolation. Newly admitted animals or those showing signs of illness should be isolated from healthy animals for observation and testing. Sanitation. Regular cleaning and disinfection of the facility, tools, and equipment using approved disinfectants for specific pathogens. Personal protective equipment, PPE. Caregivers should wear gloves, masks, and gowns to avoid cross-contamination. These measures help in controlling disease outbreaks and ensuring the safety of both animals and humans in the facility. What is the importance of personal hygiene and protective clothing for animal caregivers in disease prevention, and what guidelines should caregivers follow in this regard? Answer: personal hygiene and protective clothing are integral to minimizing the risk of transmitting infectious agents between animals and humans, especially in environments where zoonotic diseases are a concern. Caregivers should practice strict hygiene protocols to protect both themselves and the animals under their care. Key hygiene practices include hand washing. Caregivers should wash hands thoroughly with soap and water before and after handling animals, as well as after cleaning cages or handling waste. Protective clothing, wearing gloves, gowns, masks, and face shields to prevent direct contact with bodily fluids, feces, or contaminated surfaces. Footwear. Dedicated, closed-toed shoes or boots should be worn to avoid tracking pathogens outside the facility. The Work Health and Safety Act 2011 outlines requirements for hygiene and the use of PPE in workplaces where the risk of contamination is high. In animal care settings, following these standards ensures a safe environment and helps prevent the spread of diseases like leptospirosis or avian influenza. Sarah works in an animal shelter that recently admitted a group of dogs from a region known for high cases of canine parvovirus. The shelter is overcrowded, and there are limited quarantine facilities. What should Sarah do to ensure the health and safety of all animals in the shelter, including those with potential exposure to the virus? Answer: Sarah should take immediate action to implement stringent biosecurity and quarantine measures to minimize the risk of disease transmission. In this case, where space is limited, Sarah should isolate the new dogs, place the newly admitted dogs in a dedicated, well-ventilated quarantine area separate from healthy animals. Parvovirus is highly contagious, so it is essential to limit exposure, monitor for symptoms. Sarah should monitor the new dogs for signs of parvovirus, such as vomiting, diarrhea, or lethargy. If symptoms develop, these animals should be immediately separated and treated. Increase sanitation. Thoroughly clean and disinfect the facility using an appropriate disinfectant proven to be effective against parvovirus. Areas that have been in contact with the new animals should be cleaned more frequently. Minimize traffic. Limit human and animal movement within the shelter to prevent cross-contamination. Staff should wear protective clothing, gloves, gowns, masks, and wash their hands frequently. Explain the key elements of a disinfection protocol for animal care facilities and why is it necessary to use specific disinfectants for different pathogens? Answer: a disinfection protocol for animal care facilities involves several critical steps to ensure the thorough cleaning and sanitization of surfaces, equipment, and animal habitats. These elements include pre-cleaning, removing dirt, organic matter, and debris from surfaces before disinfecting. This helps disinfectants to work more effectively. Selection of disinfectants. Different pathogens require different types of disinfectants. For example, bleach, sodium hypochlorite is effective against bacteria like E. coli, while other viruses such as parvovirus may require a more specific disinfectant like Vercan or accelerated hydrogen peroxide. Contact time, ensuring the disinfectant is left on surfaces for the recommended contact time, usually several minutes, to kill pathogens effectively. Rinse and dry. After disinfecting, surfaces should be rinsed with clean water and allowed to dry completely to avoid any chemical residues that could harm animals. Routine disinfection. Establishing a regular disinfection schedule is vital, especially in high-risk areas such as feeding stations, animal pens, and surgical areas. The Australian Code of Practice for the Care and Use of Animals for Scientific Purposes outlines requirements for facility cleanliness, emphasizing the use of effective disinfectants to manage the risk of disease transmission. It is crucial to match disinfectant types to the pathogens present in the facility to prevent ineffective cleaning. What role does proper animal waste management play in preventing the spread of disease in animal care facilities, and what are the best practices for handling animal waste? Answer: proper animal waste management is essential for controlling disease transmission in animal care facilities. Animal waste, such as feces, urine, and bedding, can harbor pathogens like bacteria, parasites, and viruses that could spread to other animals or humans if not managed correctly. Best practices for animal waste management include immediate removal. Animal waste should be removed as quickly as possible to minimize contamination of the environment. This is especially important for high-risk areas like kennels or cages. Proper disposal. Waste should be disposed of in designated containers that are leak-proof and lined with appropriate materials to prevent leakage and contamination. The containers should be emptied regularly to avoid buildup. Composting and incineration. For larger facilities, animal waste can be composted or incinerated following local environmental regulations to reduce the risk of disease transmission. Disinfection. After waste removal, surfaces and equipment used in waste management should be thoroughly cleaned and disinfected. What are the primary responsibilities of a caregiver when administering medications and treatments to animals, and how can errors in medication administration be avoided? Answer: caregivers are responsible for ensuring that medications and treatments are administered safely and correctly to animals under their care. This includes accurate dosage, administering the correct dose as prescribed by a veterinarian, considering factors such as the animal's size, species, and health condition. Correct administration method, knowing how to administer medications, e.g. orally, topically, by injection, and using the proper equipment, e.g. syringes, pill crushers, monitoring for side effects. After administering medication, caregivers must observe the animal for any adverse reactions such as vomiting, lethargy, or allergic reactions. Record keeping, maintaining accurate records of all medications administered, including the dosage, time, and method of administration. To avoid errors, caregivers should double-check the medication label to ensure the correct drug is given, use appropriate equipment and techniques for the administration method, consult with a veterinarian if there is any doubt about the medication or its dosage. Explain the importance of recognizing signs of animal distress and how should caregivers respond to distress signals from animals in their care. Answer: recognizing signs of distress in animals is crucial for providing timely care and preventing further harm. Animals may show signs of distress due to pain, fear, illness, or environmental stresses. Common signs of distress include behavioral changes, unusual aggression, withdrawal, or vocalization, physical symptoms, rapid breathing, excessive salivation, or limping, changes in eating or drinking habits, refusal to eat, drink excessively, or show signs of nausea. Caregivers should assess the situation, determine the likely cause of distress, pain, fear, illness, and seek assistance from a veterinarian if necessary. Provide comfort. If possible, remove the animal from stress-inducing situations and offer soothing words or gentle handling. Continuously monitor the animal's condition to ensure no further complications arise. The Animal Welfare Act 2002 emphasizes the responsibility of caregivers to address distress in animals, promptly ensuring their health and welfare. What is the role of veterinary assistance in emergency animal care, and what should be done if a caregiver encounters an animal with a life-threatening injury? Answer: veterinary assistance plays a crucial role in managing emergencies, as veterinary professionals are trained to assess, diagnose, and treat injuries and illnesses that may pose a threat to an animal's life. If a caregiver encounters an animal with a life-threatening injury, the following steps should be taken. Assess the situation. Quickly evaluate the severity of the injury and the animal's condition, e.g., bleeding, shock, breathing issues. Stabilize the animal. If possible, perform basic first aid, such as applying pressure to stop bleeding or performing CPR. Contact a veterinarian. In any emergency, the caregiver should contact a veterinarian immediately for advice or assistance. Transport the animal. If the injury is severe, the animal should be transported to a veterinary clinic or hospital for advanced care, ensuring it is done safely to avoid further harm. The Australian Veterinary Association provides guidance on emergency care procedures, including triage and stabilization techniques for animals with serious injuries. What is the proper technique for basic wound care and bandaging in animals, and why is it critical to keep wounds clean and dry? Answer: basic wound care and bandaging involve several key steps to promote healing and prevent infection. Clean the wound. Use a mild antiseptic solution to clean the wound and remove dirt or debris. Apply an appropriate dressing. Place a sterile gauze pad over the wound, followed by a bandage that holds it in place without applying excessive pressure. Secure the bandage. Use cohesive or non-adhesive bandage material to secure the dressing, ensuring it is snug but not too tight. Monitor. Regularly check the bandage for signs of infection, redness, swelling, discharge, and replace it as needed. Keeping the wound clean and dry is crucial to prevent infection. Moisture can create an ideal environment for bacteria to grow, while dirt and debris can lead to more severe infections. The Australian Animal Welfare Standards outline the importance of proper wound care and hygiene to maintain the health of animals under care. Explain the importance of CPR and resuscitation techniques for animals, and how should caregivers perform these procedures in the event of an emergency? Answer: CPR and resuscitation techniques are vital for animals that have stopped breathing or have no detectable pulse due to trauma, drowning, or other emergencies. Caregivers must act quickly to save the animal's life. The procedure includes: check for breathing and pulse. Before starting CPR, ensure the animal is not breathing and has no pulse. For small animals, check the pulse of the femoral artery, and for larger animals, check at the jugular. Perform chest compressions. For small animals, place one hand on the chest and apply firm compressions. For larger animals, use both hands to compress the chest at a depth of about 1/3 of the chest cavity. Rescue breathing. If the animal is not breathing, perform rescue breathing by sealing the animal's mouth and nose and blowing air into the lungs until the chest rises. Continue CPR. Perform chest compressions and rescue breaths in a ratio of 30 compressions to 2 breaths, continuing until the animal begins to breathe on its own or emergency veterinary help arrives. Explain the key components of a post-operative care and recovery protocol for a domesticated animal. How do these protocols differ for exotic animals? Answer: post-operative care and recovery protocols are crucial for ensuring that animals recover safely from surgery and return to a normal, healthy state. The key components typically include pain management, administering analgesics either through injections, oral medications, or topical treatments to manage pain, monitoring vital signs, regular checks of temperature, pulse, respiration, and blood pressure to detect any post-surgical complications, wound care, ensuring that the surgical site is kept clean, dry, and free from infection. This includes changing bandages and applying topical antiseptics if needed, hydration and nutrition. providing proper nutrition and ensuring the animal stays hydrated, often with a gradual return to food intake, limited activity, restricting movement to avoid stress on surgical sites, and allowing healing. For exotic animals, these protocols can differ significantly. For example, reptiles may require specialized heating and UV light to aid recovery, while birds might need different pain management strategies due to their sensitive respiratory systems. Additionally, exotic animals may have specific dietary needs or require different types of wound care based on their natural history. Relevant regulations. The Australian Animal Welfare Standards and Guidelines always provide comprehensive protocols for animal care in post-operative recovery with a focus on minimizing pain and stress. Regulations for exotic species are also guided by local wildlife protection laws, such as the National Parks and Wildlife Act, which dictates proper care and conservation efforts. Mr. Thompson, a wildlife rehabilitator, is caring for a seriously injured kangaroo that requires physical therapy. He is uncertain about which physical therapy technique would be the most appropriate for this species. How should Mr. Thompson decide on the proper technique, and what should he consider when designing the rehabilitation plan? Answer: Mr. Thompson should first consider the species-specific needs of the kangaroo, including its natural behavior, biomechanics, and the type of injury. He should consult veterinary experts. Seeking advice from veterinarians who specialize in marsupial care is essential. Identify the injury type. The physical therapy plan will vary depending on whether the injury is musculoskeletal, neurological, or due to trauma, such as fractures. Each type of injury requires specific rehabilitation techniques. Natural movements. Since kangaroos are naturally adapted to hopping, rehabilitation should incorporate activities that mimic these movements once the animal is stable. This might include supervised hopping exercises or using specially designed equipment to simulate hopping in a controlled environment. Pain and stress management. Minimizing pain and stress is critical during the rehabilitation process. When designing a rehabilitation plan, Mr. Thompson should also consider the length of rehabilitation, environmental factors, temperature, lighting, etc., and any ethical concerns related to keeping the kangaroo in captivity during recovery. Discuss the ethical issues surrounding the rehabilitation of injured wildlife. How do these issues affect the decisions made by animal care professionals? Answer: ethical issues in wildlife rehabilitation include release versus captivity, the dilemma of whether an animal should be rehabilitated for release back into the wild or kept in captivity, especially if it has lost the ability to survive independently. Animal welfare versus human interest. The decision-making process should prioritize the animal's well-being over human interests, ensuring that the rehabilitation process aligns with ethical standards for wildlife care. Impact on ecosystems. Introducing rehabilitated animals into the wild can sometimes pose a risk to local ecosystems. For example, an animal that has been treated for an injury may carry pathogens or have behaviors that disrupt the local food chain. Pain and suffering. Ethical concerns also arise in situations where the animal may face prolonged suffering during the rehabilitation process. These issues significantly influence rehabilitation decisions, as animal care professionals must balance the animal's health, the risk to the environment, and broader ethical principles such as beneficence, acting in the animal's best interests, and non-maleficence, avoiding harm. What are the key differences between physical therapy and behavioral rehabilitation for injured animals? Answer: physical therapy focuses on addressing the physical injuries sustained by an animal, such as fractures, soft tissue damage, or post-surgical recovery. Techniques include range of motion exercises to restore joint function and prevent stiffness, strengthening exercises to rebuild muscle strength after immobilization or injury, hydrotherapy, using water-based exercises to support the animal's weight while providing resistance. Behavioral rehabilitation, on the other hand, focuses on mental and emotional recovery, especially in cases where the animal has experienced trauma or long-term stress. Techniques include desensitization, gradually exposing the animal to stimuli that caused stress to reduce fear responses. Socialization, reintroducing the animal to conspecifics, members of the same species, or humans depending on its history and needs. Enrichment programs, providing environmental enrichment to stimulate cognitive function and reduce stress-related behaviors. Emily, a veterinarian at a rehabilitation center, is tasked with treating a critically endangered bird species with a leg injury. Given the species' endangered status, what additional considerations must Emily take into account during the treatment and recovery process? Answer: in the case of a critically endangered species, Emily must take several additional considerations into account. conservation priorities, the treatment plan should prioritize not just the bird's health but also its role in the conservation of the species. Emily should ensure that the injury does not impair the bird's ability to reproduce or survive in the wild. Genetic diversity. The bird's genetic makeup may be critical for the long-term survival of the species. Any treatment that could harm its fertility or health in the future should be carefully considered. Veterinary expertise. Specialized veterinary care for endangered species may require collaboration with experts in avian medicine or wildlife rehabilitation to ensure the most appropriate care and treatment. Euthanasia is a last resort. If the injury is severe and will significantly impact the bird's quality of life or future survival, euthanasia may need to be considered, but only after thorough consultation with conservationists and wildlife specialists. How do habitat restoration efforts contribute to the long-term recovery and conservation of wildlife species, particularly for those that have been rehabilitated from injuries or illnesses? Answer: habitat restoration is a vital component of wildlife recovery, especially for species that have been rehabilitated. Restoring a species' natural habitat can provide several benefits. Re-establishing natural food sources. Many wildlife species rely on specific ecosystems for food. Habitat restoration ensures that food sources are available for the species when they are reintroduced to the wild. Minimizing human-animal conflicts. Proper habitat restoration can reduce the likelihood of animals coming into conflict with humans, which often leads to injury or death. Rebuilding ecosystem health. Healthy ecosystems support biodiversity, ensuring the long-term survival of species, including those that have been rehabilitated. Relevant guidelines. The Environmental Protection and Biodiversity Conservation Act (EPCAC) regulates habitat restoration efforts and prioritizes conservation activities that directly benefit endangered and threatened species. What ethical concerns arise when dealing with the rehabilitation of exotic animals kept as pets, and what is the role of animal care professionals in such cases? Answer: the rehabilitation of exotic pets raises several ethical concerns. Animal welfare. Exotic animals often suffer from inadequate care in captivity due to owners' lack of understanding of their species-specific needs. When such animals are brought to rehabilitation centers, their welfare should be prioritized. Release versus continued care. If the exotic animal is too accustomed to human interaction or has been kept in poor conditions, it may not be suitable for release back into the wild. The decision should consider whether rehabilitation will help restore the animal to its natural state. Conservation considerations. In some cases, rehabilitating exotic pets may divert resources from more urgent conservation efforts for wild populations, especially for species at risk of extinction in the wild. Animal care professionals must navigate these ethical dilemmas by adhering to animal welfare laws, consulting with experts on species-specific care, and ensuring that rehabilitation efforts align with broader conservation goals. What is the role of behavioral rehabilitation in post-traumatic recovery for wildlife species, and how does it differ from physical rehabilitation? Answer: behavioral rehabilitation addresses the psychological impacts of trauma, such as fear or stress caused by injury or human interaction. For example, animals recovering from road accidents may experience post-traumatic stress. Techniques include conditioned habituation, gradual exposure to human presence or certain environments to reduce stress, socialization, reintroducing animals to their social groups if they were separated during recovery. Unlike physical rehabilitation, which focuses on restoring bodily function, behavioral rehabilitation is focused on reconditioning the animal's mental state to prepare it for successful reintegration into the wild. How do Australian laws and ethical guidelines influence the rehabilitation and release of endangered species into the wild, particularly in relation to the risk of re-injury? Answer: the rehabilitation and release of endangered species are highly regulated. Australian wildlife protection laws mandate that the rehabilitation process ensures that animals are fit for release and that their return to the wild does not pose a risk to the population. Ethical guidelines stress that minimizing re-injury. Wildlife professionals must ensure that the animal can function normally in the wild and is unlikely to sustain further injuries. Monitoring post-release. Some animals are monitored after release to assess their adaptation and survival rates. If they are at risk, interventions may be needed. The National Parks and Wildlife Act sets guidelines for the care and release of endangered species, emphasizing that the goal of rehabilitation is to restore animals to their natural environments, not just keep them alive. Explain the importance of monitoring recovery progress and setbacks during an animal's rehabilitation process. How should setbacks be handled, particularly for wildlife species? Answer: monitoring recovery is critical to assessing an animal's progress and ensuring that it is not suffering unnecessarily. Setbacks such as infections, re-injury, or stress, should be promptly addressed by re-evaluating the treatment plan. A setback may require a change in the rehabilitation approach, including pain management adjustments or modified physical therapy techniques. Veterinary intervention. If setbacks are medical in nature, involving specialists is essential to determine the appropriate intervention. Ethical considerations. For wildlife, setbacks can often result in the need for euthanasia if the animal's quality of life is significantly compromised in accordance with ethical guidelines. Relevant laws. The Australian Animal Welfare Standards and Guidelines provide standards for monitoring, recovery, and ensuring that setbacks are managed effectively and humanely.